It's September the 10th, 2020, and welcome to the Water Action Platform. To avoid any technical problems, this webinar was pre-recorded just before being broadcast live, but I'm online as it's being broadcast, so if you've got any questions, please raise them in the chat box, which you can access by clicking on the purple triangle to the right of your screen. Now, this platform is dedicated to collaboration and knowledge sharing within the water sector. It is open to all and free at the point of use. We thank all our sponsors and partners, and I'm delighted to announce that we have two new sponsors, the global engineering firm Stantec and ABCOM, the Brazilian Association for Concessionaries. Today's webinar includes a special highlight, namely some exclusive feedback from Mike Brewster, Chief Executive of Taswater. And our technology showcase is an LED-powered UV disinfection system. You're going to love it. Regular viewers will remember that a month ago, a week after the terrible accident in Lebanon, we set up the Crisis Response Register. The CRR is a register for water professionals who are open to being approached at times of national or international crisis. Now, due to time pressures, I'm not going to speak much about the CRR today. Suffice to say that the register grows in popularity with almost 200 volunteers from over 30 countries involved. We have spoken to multiple NGOs and made direct links between people on the ground in Lebanon and organisations who can help them. The situation in Lebanon is now moving gradually forward. So we're looking at how this register could be used elsewhere. For example, Oxfam Australia have asked us if we could share the names of volunteers who are based in the Pacific, and those people then might be able to help during the forthcoming monsoon season. I provide a separate, more detailed email update to everyone on the CRR about how things are progressing. If you want to be involved, please follow this link. Now, if this webinar was a meal in a fine restaurant, we now come to the first course. You've had the breadsticks, are you ready for the entree? Now, as usual, this part of the webinar is where we provide an overview of some of the key information which has been discussed and shared on our various knowledge hubs and WhatsApp forums. This week, I thought it would be fun to pick out my favourite stories and share them with you as a top 7. So let's start. And we start with this newspaper article from the Washington Post. It shares an uplifting story about how wastewater-based epidemiology has been used to stop a COVID-19 outbreak before it even began. Now, with university students currently returning to their studies, the timeliness of this story will not be lost on you. In summary, the University of Arizona has been monitoring the wastewater in student dormitories. They found viral RNA, even though the students had all tested negative just a few days before. So the university retested all 311 of the residents and found 2 students who were asymptomatic but now tested positive for the virus. Those students were then quarantined and the pandemic was averted. This is wastewater-based epidemiology in action. This is wastewater-based epidemiology at its best. At number 6, we have this research paper from Du et al. Now, you no doubt recall that we've talked previously about how the testing of old historic sewage samples has shown that COVID-19 pandemic was spreading around the world long before we were aware of it, long before clinical cases were being observed. Now, those tests were mainly taken from single samples that were found in forgotten freezer trays, and they needed corroboration or contradiction by further studies. Well, here's some corroboration, and it comes from old nasal swabs. Researchers at the University of Texas in Austin and the University of Hong Kong have extrapolated the extent of the COVID-19 pandemic in both Wuhan and Seattle based on retested swabs taken from patients who are exhibiting flu-like illnesses during the early part of the year. Now, when the samples were analysed, most turned out to be flu, but some were positive for SARS-CoV-2. The data implies that there was at least 1 case of COVID-19 for every 2 cases of flu. And that is, I suspect, much higher than any of us would have anticipated, and perhaps gives us an insight into what we can expect during the likely soon to be upon us flu season. Now, at number 5, we have another international research paper. It reports on how scientists have found the coronavirus in a 16th floor, long vacated apartment. How on earth did the virus get there? The probable answer is fecal aerosol plumes produced during toilet flushing. In February 2020, in Guangzhou, China, SARS-CoV-2 RNA was found on the surfaces, taps and shower handles, in a bathroom in a long-vacated 16th floor apartment. The apartment was directly above the apartment that had had 5 people who had tested positive for COVID-19. An on-site tracer simulation experiment was conducted to see whether the virus could be spread through the waste pipe aerosols created with the force of a toilet flush. They found aerosols in bathrooms up to 12 levels above the COVID-19 cases. A fluid dynamics simulation showed, and I quote here, a massive upward transport of the virus aerosol particles during flushing, which is what had led to the large-scale indoor spread of the virus. So what's the learning here? Well, it's not rocket science and it's not new news. But if you live in a building with multiple connected sewer systems, open the windows often, wash your hands with soap and water, and clean surfaces thoroughly with disinfectants, especially in the bathroom and kitchen. Now, at number 4, we have this sage advice from 2 pediatric doctors who have gathered hard evidence that the vast majority of infected children have mild or unrecognized symptoms. But they play an important epidemiological role in the spread of the infection. These scientists did a number of studies and noted that not all children have symptoms. 22% were asymptomatic and 51% had such mild symptoms that they hadn't even complained of feeling unwell. Infected children are much more likely to go unnoticed than adults, either with or without symptoms, as they continue about their usual activities. Now, with children going back to school after the Northern Hemisphere summer break, this is particularly pertinent news. Basically, the broad advice is keep away from children, especially if you're elderly or at risk. At number 3, we have this fascinating report into the water supply in Cambodia. Now, I know this might seem a strangely specific thing to highlight in my top 7, but stick with me because all will become clear. This study was conducted by WaterAid Australia and the Cambodian Water Association in May 2020, and it shows that only 42% of the healthcare facilities in Cambodia had access to a connected water supply. Now, a similar percentage, 44%, had their own drilled well or borehole, which is arguably suitable, assuming that they're well maintained and operated. But note how 13% are using unprotected water sources. Now, that is the official healthcare facilities, so it doesn't take much to imagine how much worse served the domestic populations are going to be. Now, that story leads rather neatly onto my next one, and it is a story of entrepreneurial spirit and foresight which could lead to improving the lives, no, scratch that, could lead to saving the lives of many people around the world. Now, we all know that washing your hands is vital in the defense against the virus. Of course, it's all very well telling people to wash their hands regularly with soap for 20 seconds, but that rings hollow if you don't have access to water. So enter Happy Tap. Happy Tap is a social business that designs, manufactures and sells the Happy Tap, an easy-to-install, water-efficient, durable hand-washing station. It has been referenced by both the World Health Organization and UNICEF. The fortuitous irony here is that Happy Tap was developed long before COVID-19 came along. All that hard work that's required to design, test, manufacture such a product had already been done. The team at Happy Tap have a product that is so fit for purpose that it is now being adopted in schools in the UK, allowing them to reopen safely with a child-friendly design at an affordable price. The tiny team at Happy Tap, who are based in Cambodia, Vietnam and Bangladesh, are currently raising funds to enable them to expand their distribution capacity so that they can serve communities in both those countries and in India, Nepal, Myanmar, Indonesia, Philippines, Kenya and Ethiopia. For more details, visit their website or drop me an email and I'll introduce you to the chief executive. And now, in the prestigious top spot for this week, we have this absolutely fascinating piece of work. It is a water security risk index for COVID-19. It was funded by the Australian government through the Australian Water Partnership and implemented through the International Water Centre and Griffith University. It is a brilliant idea, and I promise you that if you click on the link, you will find it very hard to resist being drawn in deeper. The index rates countries in the Indo-Pacific region according to their holistic COVID-19 risk. The aim is to identify which water-based interventions might give the most impact. It's very simple to use. You select a country or a region and a risk factor, and you can look at the risk for a selected region overall. The overarching objective was to create an index that would allow the reader to understand and prioritise what risk investments could be made to reduce that country's risk in the short, medium and long term. It uses elements of health, economics and water security to assess each country's ability to respond. It is the best such tool that I have seen so far, and through this platform I have seen a lot of them. It is a truly brilliant index and well worth looking at in more detail. We now come to our sector expert. Now, if this webinar was a fine meal, this is perhaps the main course. This week we have an exclusive insight from Mike Brewster, Chief Executive of Taswater. Now, back in April, Mike wrote a board paper on how Taswater were preparing for the post-COVID-19 world. It currently stands as the most requested document on the Water Action platform, having been accessed by over 50 utilities from all around the world. 4 months on, how did things go? What worked and what didn't?
Hi, my name's Michael Brewster. I'm the CEO of Taswater in Tasmania, Australia. I've been asked to give a bit of an overview of the development of our business recovery team by peers. So with that, I might move straight into it. So starting with a little bit about Taswater. So we're a business of about 900 people. We've got about $3.5 billion of assets under management. We have interesting challenges with our scale. So we have lots and lots of plants, about 200 plants nominally, and about 11,000 kilometres of underground pipework. And our primary purpose is to focus on water and sewage services to the state of Tasmania. So when COVID-19 really took hold, it became apparent that our current incident management system was critical, but was really not designed for this type of incident. And I imagine that's the same for most businesses. So we decided what we needed was a dedicated executive and a dedicated team that could focus on the future and how we could emerge from COVID-19 as a much better business than the one we went in as. We had two primary objectives: to provide a centralised group for coordinating the recovery and resumption of the business functions, and to ensure we learnt from the incident and embraced advantageous new ways of doing business that allow us to be more efficient, to faster track our cultural journey, and most importantly, deliver better outcomes for our customers. We put in place 3 phases of the work. So business recovery was the first phase, so needed to identify, well, what did we actually lose as a result of the pandemic, and put in plans to recover those. The second phase is business enhancement. So what can we and should we do to make us a better business post-COVID-19? And lastly, we wanted an independent review of how we went. So we've set up a post-incident review from an independent firm to test how effective our management of the incident was, so that we can learn from what went well and what we could have done better. So a little bit on the current status. So we've actually just stood down our incident management team, but the crisis management team and business recovery team are ongoing. The business recovery team are still working on new policies, new technologies, new processes, going to that theme of how do we make it a better business. And as forecast earlier, we've just engaged an independent auditor to commence work on the independent review. So did it meet expectations in terms of setting up a business recovery team for COVID-19? I'd have to say largely yes. Some examples, some of the things that we actually managed to tackle in weeks would have taken months or even maybe years in the past, with new ways of doing things being adopted. So design sprints, agile design principles, embracing new digital technologies, new productivity gains, and obviously with everybody moving to work from home, and largely whilst it's anecdotal, and I'll cover that in a minute, productivity appears on the face of it not to have been too badly impacted. In fact, it's been very difficult to find areas where it's dropped off. A little bit about some examples of what the business recovery team have taken on. So they're responsible for the challenge of measuring and maintaining productivity. They've been responsible for our return to site. So what we mean is returning to all of our offices, and for setting up pilots for new opportunities and new ways of working. They've taken on some of our more difficult long-term policy challenges, all of which are going well. And interestingly, there's a groundswell of new ideas on how we can do things better. And that's coming from our people, which is terrific. And the business recovery team provides us with a team to actually capture, analyse, test and prioritise those opportunities. And it also has a purpose of challenging our old ways of thinking. So we're not allowed to get away with just immediately, if you like, backsliding to the old ways. A little bit on critical success factors. So in hindsight, as these things always are, we did an upfront RACI, and that was critical. It minimised duplication of roles, made it clear what really mattered and who was responsible for what. I think you've got to have a small, nimble and dedicated team, and you just bring people in and out as required. I think the decision to appoint a dedicated executive was critical. It allowed decisions to be made quickly, and for the team to have a voice at the executive table and board meetings. Another critical success factor is you've got to communicate. You've got to be continually communicating to the broader business what the business recovery team's doing, and the benefits of the opportunities that are being taken up. And of course, like everything, if you don't give them a budget, there's probably not a lot they can do. So we put a budget up front. It wasn't a big budget, but ensured they had the funds to make things happen. So a little bit on what has worked well. I think the regular communications from the business recovery team has been a big part of maintaining our staff morale and confidence of the board. Leveraging new and existing technologies and software such as SharePoint for us, the design sprints to improve customer experiences, rapid deployment of customer tracking systems, policy changes. They've all gone pretty well for us, I must say. The team challenging our pre-COVID assumptions about the way we do business and being prepared to do it in a respectful but robust way, because there is a tendency, particularly for long-serving executives, I suppose, like myself, to think, oh, the old way is pretty good, always worked for me, why don't we go back there? So I'm not allowed to do that. I'm challenged if I move to that, and I think that's been a great thing. I think we've continued to deliver our critical services through the pandemic, which is obviously a key factor. And the virtual teams concept has been terrific in also developing new ways of doing things. They're the good things. So what didn't work? I must admit that we had great difficulty in pinning down actual data to determine true productivity impact of COVID-19. We've worked with other businesses on that, and I think everyone's hit the same struggle. Unfortunately, we found the best we could do was really look at our work, look at our service standards, but actually getting true confidence in reliable data is quite difficult. What would I do differently if I was starting again, or what do I wish I knew at the outset? Probably not much I would change with hindsight. I think it seems to have worked pretty well so far. Now, bear in mind, COVID-19's far from finished, and so therefore this has all got a long way to go. But at this point in time, I don't have too many regrets. I think I do reflect on the importance of the effort put in up front to get a very clear scope and boundaries for all of the teams was critical. I think if you don't do that, then it's going to be very difficult to succeed because you'll end up with overlapping responsibility. So, look, I want to thank Piers and for the opportunity to share our learnings from this exercise, and I'm delighted to have had the opportunity to take you through our experience. So thank you.
Thank you, Mike, for sharing that update. We wish you the very best. We now come to our regular technology showcase section, and this week it's the UV company Typhon Treatment Systems. As always, I open with the statement that Isle has no commercial ties with Typhon. We identified them through our ongoing technology approval group forums, which I won't discuss here, but if you want more details, drop me an email. Typhon is being highlighted because they have developed an LED-based UV system which has exceptional energy efficiency. As you will see shortly, their complex array of reflectors distributes the photons from the LEDs to inactivate microorganisms without the need for mercury or submerged lamps. Typhon claims to be the most optically and electrically efficient method for applying UV radiation from LEDs. Here is the Chief Executive of Typhon, Peter McNulty, sharing some more details.
That is an illustration of the way the equipment looks as if you were peering down into it from above. There are 1,000 LEDs in our large scale 300 millimeter, which is about 12-inch diameter reactor. And the photonic efficiency is afforded by the very even distribution of photons through the cross-section of that reactor, much more so than with an array of long, thin tubes in the cross-section. So it is an open tube. The inner sleeve is a quartz tube. There are an array of reflectors where the LEDs are mounted to, and that is what creates the shape that you saw in the previous slide. This is the fulcrum of our intellectual property and the basis of our patents, and why it is that we are able to compete with mercury lamps now when the electrical efficiency of our treatment technology is not as high as it is for mercury lamps. There is a hotspot in the middle. This is where the beams overlap. And in fact, one of the additional bumps in efficiency that we get is we swirl the water as it comes through the reactor, and that actually moves that hotspot back and forth with respect to dose. We also have an advanced oxidation process. Many of you will be familiar with a traditional mercury lamp and hydrogen peroxide AOP system. So we did some research into this and found actually that for our process, the ability to manipulate the wavelength gave us a huge advantage over treatment with hydrogen peroxide. We use a species of chlorine. We manipulate the pH a tiny bit to push around what species we're seeing. And we use actually 292 nanometer UV LEDs to achieve that hydroxyl radical formation, and actually also a little bit of chlorine radical. So the molar absorptivity coefficient is 13 times higher than hydrogen peroxide compared to 254, and 680 times higher than the traditional medium pressure lamp system. So we have reduced power demand, reduced chemical demand. We don't need a lot of chlorine to achieve the desired outcome, and there is no need for residual chemical quenching.
So Typhon's disinfection system has been validated under the US EPA protocols, and recent large-scale tests undertaken with a UK utility to remove a taste and odor compound geosim exceeded the expected performance. Capital costs appear to be similar to conventional mercury UV equipment. The big saving, however, comes from the energy efficiency, with up to 90% saving over current state-of-the-art UV systems. Looking forward, Typhon is set to install the first 6 reactors at a UK drinking water treatment facility for disinfection. For more details, visit their website, contact Peter directly, or drop me an email. And finally, we come to the cheese and biscuit section of this webinar with one final story which will, I suspect, drive the anti-vaxxers crazy. It is a preprint paper which has reported several ongoing clinical trials to assess whether existing vaccines afford any protection against SARS-CoV-2 infection. After looking at the records of over 137,000 people, they found that 7 different vaccines were seen to have a positive effect at decreasing SARS-CoV-2 incidence. Fascinatingly, A blood group stratified analysis revealed that a significantly lower SARS-CoV-2 rate was seen among black individuals who had taken the PCV13 vaccine. If this proves to be true, and the sample numbers are small and the work needs to be confirmed, then this is great news. This could be a particularly good, cheap, effective way to protect an otherwise vulnerable community. We will, of course, keep you informed of progress. Now with that, I bring this webinar to a close. It is 6 months since we started these webinars, and this, rather incredibly, is the 18th webinar we've held. Together, we've come such a long way. There have been dozens of expert interviews, all available on the Water Action Platform website, hundreds of stories told, and literally thousands of documents reviewed and links shared. We used to start each webinar with this map, showing the location of our members and the number of organizations involved. We now have members from 88 countries across the globe. Thank you for your continued support. I hope you find these webinars useful, and I welcome your feedback. As many of you know, ISLE is an independent technical consultancy. With a team of just under 100 people, we're relatively small, but we are enormously proud of the Water Action Platform. Supporting me is a dedicated team of professionals who help ensure that these webinars have engaging, reliable, robust content. Without that support team, these webinars could not exist. If there's anything we can do to support you and your organization, please don't hesitate to contact me. I thank again our sponsors for their ongoing support. Our next webinar will be on October the 8th at the usual times. Megan will circulate some calendar invites shortly. Keep asking questions, keep sharing, and keep safe.